Now, I want to bring in NBC News medical analyst Dr. Vin Gupta for more on the Hantavirus. Dr. Gupta, thank you so much for joining us. You know, for a lot of us, this is a virus, a term we had never heard prior to today. We're being told this is something that is spread by rodents, that it doesn't spread human to human. Talk to us about this virus. What is it, and where and how could someone contract it?
Yeah, Ellison, just the name, I think, evokes a lot of fear. And it is when we see it and where we see it, which is in the southwestern part of the United States, it can cause very severe human illness. And so what is it? This is a virus that's spread through the urine and excrement of rodents. And what typically you will get exposed to it in barns, cabins, garages in that part of the United States. So states west of the Mississippi, New Mexico, Arizona, southern part of California, parts of Texas. That's the geography. And that's the so-called deer mice is what typically is the most common carrier of this virus. And so that's the epidemiology of it. What we've seen is that it has a very high mortality rate when humans are exposed, so about 40%. And it can cause I'm a pulmonologist, it causes very severe pulmonary complications like pneumonia. That's really ultimately what ends up causing such a high mortality rate is the pulmonary complications. In some cases, kidney injury as well, but that's generally the life course of this. And often, unfortunately, Ellison, people get infected, say on a Monday, but they won't develop symptoms until, say, Friday, Saturday, and at that point, things happen pretty quickly.
You know, in big cities like New York, others, people take public transportation, and it is not uncommon to see a lot of rodents when you're in the subway, particularly here in New York. Yeah. Is that something or a place where people should be aware of this and worried about possibly contracting it this way, or is it really isolated primarily to the Southwest United States?
Mainly in the Southwest part of the United States, mainly because that type of rodent is more common in the southwestern part of the United States. To be clear, rodents of all stripes are not good for human health. They carry all other sorts of illnesses. And so if you're in the subway in New York City, good to make sure that we're doing everything we can to avoid any unintentional contact. I think obviously nobody wants to make intentional contact, but for things that you can do at home, if you're living in the southwestern part of the United States, make sure open food on, say, floors is minimized, that you're cleaning up anything that might attract rodents. Holes in garages often is the point of entry for rodents in this part of the country. Make sure that those are plugged. That's really key here. And then, especially since we're talking about it, and if you're medically high risk, if you develop flu-like symptoms, it's important more than ever before, Ellison, to get tested. Because if it's not flu, if it's not COVID, it could be something that we're not thinking of as commonly. And it's important to present to care, because supportive care here in the setting of a hospital, if needed, it can save your life.
I want to ask you before we let you go, Dr. Gupta, about Gene Hackman and the fact that he was in the home for so long with his wife deceased and was either unable to call for help or unaware of what had happened. He did have severe Alzheimer's. Talk to us about how that manifests, how disorienting it would be if you were to lose your primary caregiver in that state.
Well, I think it sounds like, we're understanding more just minute to minute, but it seems like he was unable to perform his own activities of daily living, Ellison. So in that case, in the setting of Alzheimer's dementia, it is incredibly disorienting, and he's not able to care for himself. And so when you put that on top of the fact that he had atrial fibrillation, so arrhythmia that can cause your heart to beat very fast, things can spiral very quickly. And I think that's exactly what happened.
Dr. Vin Gupta, thank you so much for helping us to understand a little more about the Hantavirus and things we can do to try and stay safe. We appreciate it.
Thank you.